Hello, my name is Jared Rodenius, and today we're going to talk about competence to consent to research. This section began with discussing the risks that biomedical research has and bringing into question ethical concerns when practiced on a person whose competence is in question. The 3 rules for obtaining consent when a patient's competency is in question involves legal requirements, research, and evaluation. The legal requirements. The first rule we're covering is legal requirements. This is a product of human rights violations by the Nazis during World War II. And this set the foundation for that enacted the Nuremberg Code, restricting research on persons who either cannot consent or do not consent. The Department of Health and Human Services today regulates human research in the United States. The IRB, or the Institutional Review Board, falls under the DHHS and is required to inform any participants in research of these disclosures. 1. Statement of study, or a summary of the research. 2. The potential risks. 3. The benefits, potentially treatment. 4. Alternatives, other treatments or potential research studies that they could be a part of that would better suit them. 5. HIPAA, protecting a patient's privacy. 6. Compensation. 7. Rights. This will be an unassociated person from the research that the participants can contact and receive access and coverage for all their rights during this process. And 8. Withdraw from the study with the understanding that there should be no consequences for withdrawing. And there are additional disclosures that can include issues with pregnancy, subject termination by a researcher without the participant's consent, costs that might occur from the research, orderly termination and potential consequences on withdrawal, and statements of finding related to continued participation. And lastly, number of subjects in the study. It is a requirement that the patient is made aware of these disclosures. And that IRBs are not required to make a subject aware of the disclosures if the research only involves minimal risk. And minimal risk is considered discomfort that could be experienced on a day-to-day basis. NHHS regulations for groups with uncertain competence, such as prisoners, where prisoners are forbidden from participating in research unless the research is directly related to the study of criminal behavior and does not involve incentives for participation that would influence their decisions. Also children, and this includes children with waived parental consent due to things such as abuse, and wards of the state. However, there have been no regulations implemented on research conducted on patients who are mentally infirm. Research. Research on the mentally ill. A person with a serious disorder performs worse on a structured test than those with less serious disorders. Melton compared Alzheimer's patients performing worse than schizophrenia patients, and schizophrenia patients performing worse than depressed or controlled patients. Poor performance on consent assessments is not definitive. Educational intervention has been noted as a method to improve. Reassessments are necessary due to inconsistencies in cognitive ability. This is why research should include individuals with mental illness. However, subjects with severe mental illness are not recommended due to their fluctuating mental capacities. Research on children. Studies of children ranging from ages 7 to 12 have found that they can understand the purpose of a study, but are unable to comprehend either the risks or the benefits as adults understand. Children were found to only participate under the direction of adults. More children stopped participating in the study after being informed that no one would be upset if they quit. Experimental versus ordinary treatment. In experimental treatment, there can be such things as the therapeutic misconception, as Melton stated it, where a patient understands they're receiving treatment, but does not understand that they are part of scientific research. This is opposed to ordinary treatment, where direct information is given, understood, and received. Risk also differs. Risk in research is unknown, given the lack of testing, and risk in treatment is known due to its record and previous treatments. This also leads to different motivations, and this can vary based on personal views or outside factors. Evaluation. Evaluation methods. The MacArthur Competence Assessment Tool for clinical research assesses understanding, reasoning, appreciation, and ability to express a choice. The test is customized for these specific research protocols. Part of evaluation is increasing competency through intervention, such as video recorded and repeated learning trials. This is key during a reassessment process. This is my media source. Please see the abstract on the Competency to Consent to Research by NIH. For the discussion, would you assess the competency of a patient with depression and a patient with a mental disorder in the same way? Would you consider keeping an applicant who did not pass the assessment initially? Why or why not? And these are my references. Thank you for watching.